Here we have got AP and a cross table or horizontal beam lateral view of the left knee in 45-year-old with history of fall and unable to weight bear. So let's evaluate this radiograph in step-by-step manner. So first and foremost, I would like to talk about the soft tissues. So what we have got here is suprapatellar fullness. In the context of acute trauma, features are most likely to represent hemarthrosis. There is no fat fluid level to suggest lipohemarthrosis or fat fluid level to suggest intra-articular fracture. The rest of the soft tissues, including the patellar tendon shadow and the quadriceps tendon shadow, look unremarkable. There is no soft tissue swelling around the knee joint. Now coming to the bones away from the joint line appear unremarkable. Now let's look at the joint line. On first look, it all looks normal, but if we look carefully, there is an U-shaped lucent line on the AP view, which is at the intercondylar notch of the tibia. So let's magnify this region and evaluate it further. So when we magnify and see here, so we have got this well-defined U-shaped lucent line in the intercondylar notch of the tibia, which is not seen on the lateral radiograph. So this is abnormal, and this should never be missed. So what is this? So this is an undisplaced avulsion of the posterior aspect of the intercondylar notch of the tibia, which is at the attachment of the PCL. So this is very classical of this type of fracture, which is commonly missed in day-to-day practice. Especially the people in ED are going to miss it, and as a radiologist we should never be missing it. This is a case which comes for rapid reporting if you are taking FRCR2B.